My name is Jodie Albert. First of all, I would like to thank the Know Your Status team here at Ahtahkakoop Health Center for treating me like I was a human being. To me, it seemed like they were able to see past the diagnosis and the addiction and see me as a person, as a woman. I believe this is what really made the biggest impact for me being successful in my treatment. And yeah, so being treated this way, it gave me courage and strength, I guess, to make those necessary changes in my life that weren't that were harming me. And it also encouraged me to treat other people that way, to pass on the treatment. So that was really nice. So I would just like to say that. So my role as a Know Your Status worker, outreach worker, was many things. It was many things. I would take clients to and from the health center that they didn't have a ride if they needed to see Dr. Skinner or one of the nurses. I would take them to the doctor in Prince Albert to whatever needs that they required. And I believe that doing these short distances, traveling with them is making that connection. I think making that connection is really vital, really vital, because if you're not going to connect with anybody, then I don't believe that the work would be done. There was times when I even started taking the community members to NA meetings in the city in Prince Albert, which is an hour away. So I would just find ways to spend as much time with them during work hours or even sometimes after work hours and make that connection, you know. And having lived experience being an addict and going through the treatment, you know, I was comfortable enough to share. And you know, I hoped that it would encourage them to make the necessary steps to treat their HCV and just to connect to care, And you know, having the proper medical practitioners and professionals makes the difference. You know, like I can make that necessary connection and make that connect to care. But if our medical professionals aren't going to be inviting and being kind and compassionate and respectful, then they're not going to finish the treatment. You know, you're going to scare them off. So I believe that's really important, really important. Yeah, there was. It's just that making that connection, you know, just looking past the disease and the addictions and seeing that person, actually seeing that person, hearing that person, and listening to that person, you know, like it's that's what I find is really important. So
Thank
yeah.
you. Thank you very much. Sure, people have questions.